Today, I will be discussing my summer research through CURE. It was funding through the Summer Undergraduate Research Fellowship. I did a project on food insecurity and stress in people experiencing houselessness, and I was mentored by Dr. Joe Weaver. The project itself was a collaboration between the Global Health Biomarker Lab and the Culture and Global Health Lab based here at the University of Oregon. The larger study is funded by the National Science Foundation. Oregon as a state has the fourth highest rate of houselessness in the country, and specifically the city of Eugene has the highest rate per capita of houselessness in the country, with 14 out of every 1,000 people in the city being unhoused. Not only is this a huge societal issue, but it is a public health crisis. 73% of people surveyed that are experiencing houselessness have recorded physical health problems, and 80% have reported mental health issues. Right now, there's a huge research gap on the mechanisms and consequences of being unhoused. This creates a barrier when legislators, government officials, and nonprofit organizations are trying to help address the issue. The point of this study is to try to breach that research barrier. The main research question of the larger study asks about housing insecurity and stress. Mainly, there's four driving questions. What factors predict poor health amongst people experiencing houselessness? What factors predict better health? Are some groups healthier than others? And are some groups more vulnerable than others? When we talk about groups, our study is able to ascertain demographic groups, people of different life experiences, but also people who are in different statuses of being unhoused. So if you are chronically unhoused, if you are staying currently in temporary housing, permanent supportive housing, or if you're unsheltered on the streets. So we're trying to ascertain many different groups of people so that we can compare different research questions based on kind of the different factors that people might be experiencing. My research question is specifically around food insecurity and stress. So how does food insecurity and being food insecure impact people physiologically? And if accessing food stamps, which helps with food security, if that then shows improved physiological stress markers, do some groups have more food insecurity than others? And are there other factors that are influencing people's food security that maybe aren't just their pure access to food stamps or other government resources? The research approach for this project is centered on positive and meaningful engagement with the community. This means that all of the research processes we have done, we've piloted with feedback and community engagement. We also have constant evaluation of how we can better work with the community that we are involved in, and we have trainings that help us deal with situations that might happen during data collection, including training with using Narcan, training in tempering down high stress situations. And then we also will distribute resources while we do data collection as well to try to make sure we are serving the community that we are working with as well. The current project that I worked on all summer and that this data is from is a project that consists of both a questionnaire and biomarker collection with that has that main question centering around houselessness and health and stress. For the quantitative questionnaire, there's sections in that questionnaire about housing status, self-assessed health status, perceived social belonging, access to different social services, legal system involvement, and mental health, just to name a few. The broad goal of our questionnaire is to ascertain as much information about people, their background, and maybe what factors led them to where they are right now. And so once we have that really large database, we can start looking at relationships across different factors. So the questionnaire is very comprehensive. It takes about 30 to 45 minutes for participants to fill out, and it really gives us that broad background information that we can use. Specifically for my research, it includes questions from the USDA's food insecurity screener. And so that's what I'm using to assess if someone is food insecure. My role in the questionnaire process is walking participants through the process of informed consent and also interviewing participants through the questionnaire. We are calculating physiological stress through a measure called allostatic load. This is calculated through multiple point of care biomarker tests and is an assessment used by medical anthropologists to ascertain the effect of the environment and someone's social, environmental, and other health factors on their actual physiological stress. For this study in particular, we are assessing allostatic load by using blood pressure, lipids that includes a total cholesterol, HDL cholesterol, LDL cholesterol, and triglycerides, A1C, and hemoglobin, which all come from point of care devices. We also put blood spots onto a paper that goes back to the lab that measures C-reactive protein, which is an inflammatory protein in the blood. And we also will measure cortisol from a hair sample that we take from the back of the head. I have been trained in biomarker collection and also do informed consent for participants to participate in this part of our study as well. Preliminary analysis of the data that I have gotten for my specific research question has shown that in the past 12 months, 73% of participants reported cutting the size of their meals or skipping their meals, and 61.2% reported not eating for an entire day. For physiological stress markers, 78% of participants met the criteria for hypertension, and 9% met the criteria for diabetes based just on the point of care measurements we were able to do in the field. Here's now I'm going to discuss some graphs that show some further data. So these graphs compare food stamps and food security. So you can see whether or not someone's on food stamps and then what percentage of them answered yes to the question of skipping a meal in the past 12 months and then not eating for a whole day in the past 12 months. So as you can see, being on food stamps doesn't seem to have a super large impact on whether or not someone has skipped a meal in the past few months, and actually more people on food stamps have skipped a meal than not. In figure 2, we can see that there is a difference in people who have not eaten for a whole day who are on food stamps versus not on food stamps. But it's important to note that our sample size of people who are on food stamps is still fairly low. And so we would like to, as we continue to grow our sample, maybe look at this data again and see if anything changes once we have more participants that are on food stamps. And also kind of control for other variables when we have a larger sample as well. We also were able to look at people's access to food stamps and health insurance. To me, this is important because it shows like accessing different necessary government services that I think we would assume are available to someone who is unhoused or who is struggling financially. And so as we can see in our sample, we have a lot more people that have some kind of insurance. So either Medicaid, which is OHP, or another insurance. The majority of people have access to insurance, but the majority of people do not have access to food stamps. So that's just a disparity that can be pointed out in the research. And then with our health conditions, we wanted to also graphically represent kind of who had the markers for hypertension, who had the marker for diabetes, and then also their insurance coverage. Insurance coverage can be very important for dealing with chronic conditions. And so this was important for us to represent as well graphically. And then our last one is health conditions and treatment. I wanted to highlight that most people did not know that they had hypertension. And so that was significant because we found that most people met that criteria, and there are lifestyle changes and different things that you need to be aware of when you have hypertension. It can raise your risk for many different conditions, and diabetes, this is just accentuated even more. If someone has diabetes and is not managing it, it can be deadly pretty quickly. And so the fact that we have had some participants come in and meet the criteria for diabetes, but not have a diabetes diagnosis is extremely concerning, especially when there's a risk that they could go into ketoacidosis. And there could be a lot of issues arising from untreated diabetes that can turn deadly very quickly. The future directions for this project are dependent on waiting for more sample data to run further analyses. So in order to run the allostatic load, we need data not just from our point of care devices, but also from the lab, so the C-reactive protein and the hair cortisol. We also would like to run regression analyses on the relationships between allostatic load and food security and control for different variables to kind of see if we can ascertain what are the factors that are really contributing to food security to higher allostatic load. I also the data has shown a gap in programming for people being on health insurance, but not being on food stamps. So why are so many people experiencing houselessness not on food stamps? And are there programs or circumstances that people are involved in that are making them less vulnerable to food insecurity? Could that inform policy in the future? So that's definitely something that I would like to look into, especially since I am personally very interested in a policy approach to issues. I'd like to acknowledge all of the people that I worked with this summer. So, Dr. Joe Weaver was my faculty mentor, but there were also other professors that I worked with, Dr. Josh Snodgrass, Dr. Claire Herbert, and then the other undergrads that I worked with, grad students and staff. And then also a final thank you to Cure for funding my summer research.